next on Being Well, we'll be talking about autism spectrum disorder with Dr. Gail Richard of the Department of Communication Disorders and Sciences here at Eastern Illinois University. Autism affects 1 in 88 children and is the most common developmental disorder. Dr. Richard will explain the nature of autism, early warning signs, and how it's diagnosed. That's all coming up next, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thank you for joining us today for Being Well. Today's topic is about autism, and I'm so happy that Gail Richard, who's the department chair of the Department of Communication Disorders and Sciences here at Eastern, has joined us to talk about this topic that really affects a lot of people, and it's something that has become more prevalent in recent years. Let me ask you that. Why has it become more prevalent, do you think?
Well, our numbers have increased dramatically. We're now saying about 1 in 88. It is more prevalent in males than females, but we are definitely seeing an increase in this. And where it used to be that you might encounter someone with autism, now if you don't encounter someone with autism in the school setting, it's really unusual.
And what do we think accounts for the increase?
Well, I think there are actually several factors. I think one is that we have a better awareness. So before, when we saw some of these characteristics, we weren't real sure what it was or what to do about it. Now with awareness, I think people recognize autism, and I think that leads to the second reason is that we're diagnosing it better. And so we can get that individual to someone who can do that diagnostic evaluation. I think that also plays into some overdiagnosis. And sometimes we have people who see a young child in particular who is caught in a developmental delay. Their speech and language might be behind. They might be doing some sensory things. And so we introduce the autism label, and actually their neurology is just behind. With some intervention, it comes along, and it's really not in the autism spectrum. And then I think the third reason is that we really are seeing an increase. I think there are a variety of environmental and genetic factors that are interacting and are actually causing a lot of genetic mutations that are resulting in an increased incidence, not just of autism, but all of our developmental disabilities.
So how is autism, what is its definition, or maybe how is it classified as is it classified as an illness, or how do you describe it?
It's actually classified as a disorder. And so we don't call it an illness or suffering from, because that would imply that there's a medical treatment for it. It's really a developmental disorder. That means as the whole neurology is developing, it develops differently. The leading reason for that seems to be a genetic predisposition. And so certain areas of the brain that need to talk to each other or interconnect, the chemicals that run that are different in individuals within the autism spectrum. So those areas of the brain don't interact the way we should, and so we end up with a profile of characteristics. The leading characteristics that we see that are part of the definition of an autism spectrum, the first is a significant impairment in what we call reciprocal social interaction. So that's that ability to do an exchange with someone. Sometimes we'll have an individual in the autism spectrum who will monologue. They'll talk a lot, but they're not talking to you or with you. So it's really about a shared interaction. Second piece is why I got interested in this, which is the communication piece. The second area is really a significant deficit in verbal and nonverbal communication. So it could be that I have difficulty expressing myself, but it could also be that I don't do those nonverbals of gestures and facial expression and reading some of those gestural signs. And then the third piece is what we call restricted or repetitive patterns of behavior. And that's probably the piece that most people associate with autism. So we think about spinning and hand flapping and those repetitive motor gestures, but most of that is due to some sensory issues.
Okay.
And so their sensory system is hyperactive or hypoactive, and so they're responding to the world in a different way, and that's what results in some of those repetitive patterns of behavior. Then those differences in those three areas really need to be present during the developmental period. So it isn't that I have these skills and lose them. As I'm trying to acquire them, we see them. So the key age is about 30 to 36 months that we see these differences. Doesn't mean it's diagnosed by then, but it's when we see those differences. And so those patterns are apparent, and we're getting much better at looking earlier and earlier for seeing some of those warning signs.
Okay, well, let's talk about some of those milestones at those different ages that parents may want to be aware of. We'll put a chart on the screen that can kind of explain, but I'll have you run through those different milestone or age markers that are important to look for.
Yeah, the sooner that we can get started on this, the better for long-term prognosis. And so those early warning signs are when you have a young child, even before they're able to verbalize, but they're not paying attention to that caretaker's voice or face. We don't do joint attention kinds of things, so that lighting up and playing pat a cake and those kinds of things. So we really look for joint attention. We look for gestures, pointing and shared kinds of interaction. We also look for facial expression. And so those key things that are precursors to social interaction are our first warning signs. Then we get into some of the communication components of they don't respond to their name. They're not aware of things going on in the environment, and they may be very limited in what they output. Then we start looking for some of those abnormal behavior patterns. So when they're playing with their toys, they're lining them up, or they're spinning the wheels on the car instead of running a car the way it normally would. So we start to see some of those different behavioral patterns also.
So you talked earlier about autism spectrum. You used the word spectrum, and in my research for this show, I noticed that they've changed it to autism spectrum disorder. What precipitated the change?
Well, within the whole autism profile, what we used to have was an autism label with some different types under it. And within the medical community, they felt like there was some misdiagnosis. There was also some concern about, are we accurately putting people into the different types? And so rather than go into differential until they have definitive medical tests, they've decided to kind of put it all in one lump sum and then just look at the differences in severity. And so it's now under what they call a spectrum disorder, but because it's a spectrum, it has a variety of characteristics and symptoms, and those characteristics can vary in how they present. So it could be very mild, it could be very severe. So I may have a child who's very verbal, or a child who has apraxia and really isn't verbal at all.
Right, you hear people talking about a person who's high functioning autistic. And that's where you see this spectrum.
Right, and one of the categories that used to be there that now there's some controversy about actually is the area of Asperger Syndrome. And Asperger Syndrome is now encompassed within the autism spectrum, but it's not a standalone. But within classification that comes into existence in January of next year, it's back in, so it's a little bit confusing, but Asperger's is often referred to as kind of the genius aspect because we see normal cognitive or intellectual ability, we see very normal verbal communication skills, and we see normal really academic performance. The big deficit is in the social interaction area.
And that's that inability to interact in a I don't want to say normal, in a traditional manner with a person. Maybe they have tics or something like that. Is that kind of typical of Asperger syndrome, some of the symptoms or how a person acts?
Yeah, really, the term autism itself means self, and it's because that primary characteristic is that the individual is self-absorbed.
Right.
Everything's from their world, their perspective. I think probably an example that a lot of people can relate to is Sheldon on Big Bang, because it's always from his perspective, how it relates to him, and everything is in his world. And so that's what we call theory of mind, and it's that inability to understand somebody else's perspective. So in Asperger's, you have individuals who are very bright, incredible potential, but can you get the social skills so that they can function in the real world and be able to navigate a work environment or even a living environment?
So you touched earlier on is there really a defined, here's a list of possible causes, or this is what, I mean, that's been controversial for a very long time, but have they identified certain possible risk factors or causes of autism?
There's a variety of fronts for the research right now, and the leading research says that this is genetically encoded. So you are born with it, and you will die with it. But certainly we can modify through the symptoms if we get appropriate treatment diagnosis. In terms of causes, there's again a couple fronts, but the leading one is because it's genetically encoded, looking at specific chromosome kinds of things. So for example, chromosome 7 is very involved in speech and language. So when that's a huge component in it, we kind of look for that. That chromosome also seems to have some bearing on the differences in males versus females. There are other chromosomes, 5, 11, and 16, I think, that they're really looking at that are about the brain connectivity and these synaptic connections that don't seem to develop in the right way within this population. So there are several fronts of genetic research. But then there are also some that we would probably put more in, I would say, an environmental area, and some of those might go in a toxin category, where there's some research suggesting that if mothers are taking antidepressants and other regular chemicals during the pregnancy, that might contribute to some of these genetic mutations. But we also look at some toxins that may be present in the environment. There's an awful lot of toxic kinds of substances that our bodies haven't built up an immunity to, that we think are probably causing some genetic mutations.
Well, and toxins that are just in our environment, in our air, that weren't there 30 years ago.
Yes, yeah, and we look at even, there was a study that was kind of interesting that was done like on Easter baskets that are produced in China with the lead content in them. And you think of young kids chewing on that and think, and so that toxic piece is one. Then they're also looking at if there are some other factors, like one is a higher paternal age at when we're having children, that we keep pushing that off. It doesn't seem to be higher maternal age, but paternal age seems to have some bearing on that. So there's a lot of fronts in the research, but we really aren't to anything definitive except for a genetic predisposition. And the one that I don't know if you're going there or not, but I'll anticipate it, is there's always a lot of question about the vaccines. And I'm going to say right now that there's been pretty definitive, multiple research studies that the vaccines are not accountable for that. And the reason is that would be something that would be post-birth. And so if this is a genetic predisposition, it's already there as those brain cells are developing differently, biochemically differently, and the toxins that seem to be associated with the vaccine are really not a factor. It really was based in what was the suspension solution for the vaccine,
Not
which
the
was
vaccine
the mercury.
itself,
Right.
correct.
And that has been outlawed in this country since 2000.
Okay.
And so that really has not shown to be a factor. And there were some pretty definitive studies where they looked at across countries. They looked in Great Britain, Australia, US, and Canada, looked at incidence of autism spectrum in children who had been vaccinated and not vaccinated. Incidence was the same in all those countries with all those children. So that really is not a factor, and there's real concerns that parents are kind of jumping on that and putting their children at greater risk. They're already in an autism spectrum, which is a significant developmental disorder. Then they have no immunity toward these viral infections. And if they would get one of those with no immunity that those vaccines provide, it can have really significant ramifications for any of the senses. You can lose vision, hearing, or movement.
Okay. So we talked a little bit about some of the warning signs for autism spectrum. Let's talk about the diagnosis process. How do practitioners like yourself, how do you diagnose a child? And when can that diagnosis process begin? At what age?
Really, those warning signs are pushing down to about a year to try to pick up some of those factors. But usually, and one of the other positives, I guess, about autism spectrum is it's a generic label as opposed to definitive. So you can say, we're seeing the patterns of this and put that label on, because the way most of our insurance and services work, without a label, you can't get services. So we try to get that in place as soon as we can.
Okay.
But because there's not a definitive medical test, it's still based in good observation. So we go through that diagnostic criteria of the reciprocal social interaction, the communication deficits, the aberrant patterns of behavior, and try to substantiate those in the child. And if we have all of those pieces, we usually can introduce that. If we have one or two, it really shouldn't be autism spectrum. We should stay with a developmental delay until we really have some time in treatment to see how it's going to sort out over time.
So is there research that says if a child is diagnosed earlier and goes through therapy and treatment earlier, that they are better, that they can adapt better and are better off? The earlier it's diagnosed?
Yeah, the research shows that with the earlier diagnosis, the prognosis is always improved. And that's because even if there's a significant intellectual disability, we can still modify through those behaviors if we get started sooner. To jump in at 10 and try to modify those things is really tough. If we wait till they're even school age, like 5 or 6, to try to develop communication or social awareness, we're already behind. So most of the research says, and that's why there's now federal laws that provide services from birth to 3, and then at preschool level, and then through the school age process.
So if a parent is out there and they're picking up on maybe some of these signs, what do you recommend? Who should they see first?
That's usually the wellness checks with the physician are the first place to start, to say, we have some concerns with, they're not talking, they're not interacting, we're having a lot of behaviors that are tough for us to deal with. And sometimes the physician will then make a referral. If it is a diagnostic center where they see a lot of these children, then certainly that's a good place for these children to be diagnosed. A lot of times getting the diagnosis is a real challenge for families. And to hit some of those metropolitan areas like St. Louis, Indianapolis, Chicago, you can wait sometimes 18 months. So if you can get into birth to 3 or a physician or a diagnostic center like ours, often you can get the diagnosis and get kind of a blueprint to get started on some of those things.
And because there are resources out there, and we're going to talk about those in just a little bit. Do you want to talk about if a child is diagnosed with some autism spectrum disorder, that there's also counseling and education for the family members and the parents and the school educators as well, that's an important component to this as well? It's
a real important component. I'll back up a little bit, and if I get lost, bring me back. But one of the big issues in the autism spectrum is the sensory system is very different. They overreact to things, and that's the crux of many of their behaviors. If a parent doesn't understand that, or a teacher doesn't understand that, they can actually be pushing the buttons to make this worse. And so the education of the individuals who are going to interact with them is just critical. And sometimes just the support that where they are right now is not where they're going to stay. It will get better in response to treatment. And when you work with someone who actually does that treatment, does the intervention, they can reassure a parent. Many parents will come to me and say, are they ever going to get toilet trained? And my answer is yes, they will. But it's going to take a little longer, and it's going to be more behavioral because they don't always have that neurological awareness. And so educating other people so that they're not pushing the buttons that are actually making the child more uncomfortable or triggering more of those behaviors is really important.
What would be some common triggers that, for everybody else it's not a big deal, but maybe for a child with autism it's traumatic, it's huge?
Yeah, one is the auditory system. The auditory system tends to be very hypersensitive. And so in some of our older schools, we have fluorescent lights that to a child with autism can be like a siren going off, and they are going to be very disruptive in that setting. The auditory system also is in an environment like a loud setting. I am going to create a noise that's louder than this environment. So when I am in a restaurant or a gymnasium and it's loud, I'm going to scream louder than that because I'm trying to block that out. So being aware of the auditory system is real important. Another one is the sensory system that's here with smell, taste, and texture. A lot of these kids are very picky eaters, and so they don't get a nice nutritional balance. And we really have to do some food chaining, desensitization to get them eating more than 3 things.
Are their systems a little more sensitive to foods, like maybe wheat allergies or sugars or caffeine? Is that more common to have digestive issues?
Yeah, that's a really good question, because one type of autism that we're starting to see sort itself out is what we call an autoimmune type. And these are the children who are very sensitive to foods. They're the ones who benefit from some of the restrictive diets like gluten, casein free. They have things go through them very quickly. So they have diarrhea, they have vomiting, and they just can't absorb the nutrients before it runs through their system. So that is one type, and they can be more sensitive. And then the other sensory issue that I think parents and teachers need to understand is touch. That we see a lot of what we call tactile defensiveness. And if you walk up and touch this child, they may swing and hit you. And we also see a lot of clothing issues. If I get a drink of water and something gets wet, I'm taking all my clothes off because I can't stand that sensation. So you just need to understand how to deal with some of those sensory reactions.
Let me ask this. Can children ever outgrow autism, or can it change as they get older?
The latter. Because it seems to be genetically predisposed, you are born with it and die with it, but it absolutely gets better, and it usually responds very well to treatment.
Treatment meaning therapy, not
not medical.
Not medical.
We don't have any magic drugs yet, and that's actually the front of a lot of that genetic research, is to see if the biochemical aspect of autism is that certain things in the brain are not connecting. Can we put in a certain chemical that will allow better connection during this developmental period so that it doesn't play out this way in development? So that genetic medicine is a front of research, but we're not quite there yet. So right now, the treatments are really an intervention that is communication, that is about working the sensory system, desensitizing, and some behavioral modification.
Okay. Well, in this last few minutes, I want to talk to you about the Autism Resource Center here at Eastern that's opening in the fall of 2014. Can you talk about what services will be provided?
Yeah, this is actually an enhancement of the existing speech-language hearing clinic. So we do evaluations and therapy, but our students have to be trained in a variety of disorders. So we can only take so many, but we see a real need in downstate rural Illinois to get these families in, get the diagnosis, and get them started. So really 3 prongs is what we're looking at. The first is evaluations. The school districts in this area really don't do the evaluation, but they will take a diagnosis from a center such as ours. And so if they can come in, get an evaluation, what the center would do is, instead of just going into the queue, they would take priority. So if the question is autism, they would get in much quicker, and we would be able to see them, get a diagnosis, and that blueprint for getting started. Second piece would be some consultations. So if a school district is struggling, we could go out on site, see them in that environment, meet with the teachers, and give them some suggestions. And then the third piece would be some education. Because we're a university, we'd love to offer some classes for teachers, for parents, so that they feel more comfortable interacting with the disorder.
Okay, and that would be open to anybody in our region?
Yes,
Is there a
absolutely.
cost associated with it?
There is. Because it's a clinic, it needs to be self-supporting. So the evaluations currently in our clinic are $300. We haven't really set prices yet on consultation. The education would be what you register for through continuing education is where probably the classes would be offered.
Okay. Well, Gail, we could have you back for a part 2. There's a lot to talk about, and because it's constantly changing and new research is out there. But I think you've given our viewers and our parents out there some great information to go on. So thank you so much for coming by Being Well today.
Well, thank you for having me.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.